It's been over 5 years since Eddie Callisto Tavares lost her father when he died of COVID after an outbreak at the Maples Personal Care Home in 2020. She's been fighting for better staffing and care at personal care homes ever since.
Well, they haven't really changed. So they weren't good before. We know that there was systematic cracks in the system. If anything, the pandemic brought that forth, but nothing much has changed.
Callisto Tavares has written a letter to the Health Minister requesting an increase in funding to provide 4.5 hours of care per resident daily, up from the 3.8 required now. The ongoing issues of understaffing and inadequate care hours are well documented and require urgent government action, Callisto Tavares wrote.
The hours that are assigned right now is not enough. We've got chronic understaffing. We've got staff leaving the field because they're so burned out.
The Canadian Union of Public Employees also raised concerns with the Health Minister recently about staffing levels at personal care homes.
The residents aren't getting the care that they should be receiving. It's very rushed.
Margaret Schroeder said care homes are understaffed, which takes a toll on workers' health.
So they're leaving work in a much more exhaustive state, as well as it does take a toll emotionally on them as they are trying to give the best care that they can to the residents.
CUPE sent a February 4th letter to the Health Minister saying its leaders strongly recommend the province should require a minimum of 4.1 hours of care daily for each resident, rather than the current 3.8 hours. The lack of staffing during the pandemic led to catastrophic failures, especially in private long-term care homes where CUPE members worked tirelessly under impossible conditions, CUPE wrote in the letter. The national standard is 4.1 daily hours of care, and the Manitoba government has previously stated 4.1 hours was its goal. May Quinto is a CUPE local president and a healthcare aide at a personal care home. She says when there's understaffing, residents at the home suffer if staff are not able to provide the necessary quality of care.
It's very frustrating because your commitment to them is to make sure that they maintain their dignity. It's impossible to provide it if you are burnt out or if you are overworked.
The CUPE executive's letter to the Health Minister calls for the requirement of 4.1 hours of direct care per day to be phased in over 3 years to allow time to recruit and train staff. Vera Lynn Kubanek, CBC News, Winnipeg.